Hi, my name is Renee Thompson, and I'm going to talk about childhood obesity today. Childhood obesity is a um, health concern, and it is a growing health concern. So, I want to work in the pediatric population. So, my goal is to provide proper education to patients and their families regarding obesity. My PICO question is, in school age children, how does physical activity at school and at home compared to not being physically active influence obesity over the course of the school year? And a little bit of background information. Like I previously stated, childhood obesity has increased dramatically throughout the years, and it can lead to many chronic illnesses, including type 2 diabetes, cardiac disease, respiratory problems. It can even lead to psychological problems as well. Childhood obesity is also more prevalent in lower socioeconomic status and racial minorities. It has been shown that African Americans and Hispanics have a higher incidence of obesity than those of others. And um, if when children are obese as children, they can continue that trend as adults, which can lead to more serious problems. So it's crucial to prevent obesity in the young population so we can mitigate that as adults. Some literature review: obesity and depression can correlate with one another, because children with obesity have like negative social thinking. They have negative emotions. They may be bullied at school, which can lead to social isolation, lower self confidence, and they can be drawn into themselves, which makes them not want to be out and active, and they would rather just stay home in bed by themselves. There were a couple questionnaires and devices used that I found. One is a Block Kids Food Frequency Questionnaire, which monitors the children's dietary intake throughout the week. The children just use a scale to say how many servings of fruits and vegetables they eat versus how many servings of sweets and snacks they eat. Also, there's a accelerometer which they wear on their wrist, and it measures their physical activity throughout the day. They wear it 10 hours a day. The biggest barrier for that, though, is children forgetting to wear it for that long. So that is a little bit of a barrier to determine how physically active they are throughout the day. There's also a PEAS evaluation. It stands for Parents Practicing for Eating and Activity Scale. And it has 26 questions and it has 6 categories. And the categories are monitoring, discipline, limit setting of soda and snacks, activity behavior, pressure to eat, and reinforcement. And the parents just fill that out based off of a scale. And these tools have concluded that children don't consume enough fruits and vegetables, and they are consuming too many sugary foods and beverages instead. And they are also engaging in more screen time than physical activity throughout the day. Another big effect on obesity has been the recent coronavirus pandemic, because many schools and parks and recreation centers have been closed and children are doing school online. So they are not getting the physical activity that they need throughout the day. For my CUSIN, I chose teamwork and collaboration. It's important to have lots of teamwork to monitor and educate children and their families to prevent obesity. That can include like nurses, doctors, school teachers, physical therapists, and the family themselves. And the family is probably one of the most important aspects because children follow what they see. And so it is crucial for parents to be a positive influence for how children should eat and how they should exercise throughout the day. I also chose evidence-based practice because different treatment options work for different children. So we need to have appropriate interventions using best current evidence that we have found online. Some recommendations are to restrict unhealthy foods like maybe like in the vending machines at school to replace chips and candy with healthier options and to increase physical activity throughout the day since some children are back in school throughout the school day and after school activities, walking to and from school, exercising in the evening with their family, having whole grains, whole foods instead of sugary foods that aren't very healthy for you. Um, and to educate parents also to mitigate obesity. Some don't understand the need to, and it is important to show them that the proper food diet and the proper activity level for children and families. And then just to conclude, lack of physical activity, unhealthy nutrition, and lack of education can all lead to obesity. And it is important to target obese children and their families to decrease that rate so they can be healthier and live an active lifestyle and maybe decrease that chance of leading to serious health concerns later on in life. And when we do our treatment plans and interventions, they need to be individualized because not one treatment plan will work for every child. Thank you.